Good day, everyone. My name is Ethan, moderator for this webinar. Welcome everyone for today's webinar, Telemedicine, CMS and TJC Standards. I would like to introduce our presenter for today, Darlene Evans. Darlene Evans, MSN RN CPHQ, is a nurse consultant for Nash Healthcare Consulting. Darlene brings 25 years of experience in the healthcare industry. I would now like to hand over the floor to one of the best speakers of Nash Healthcare, Darlene Evans.
Thank you so much and Happy New Year, everybody. And thank you for joining us. So thank you especially for taking your time out to be with us in Nash Healthcare as we present the information on telemedicine, CMS, and the Joint Commission standards relative to telemedicine. We have a lot of information. Thank you for the warm welcome, by the way. Telemedicine generally referred and refers to specifically the remote clinical services that are provided. Telehealth can refer to other remote services. So with telemedicine at the time of the COVID pandemic, many organizations were able to move swiftly to put some processes in place. That waiver was called an 1135 waiver, and it talked specifically about the capability of providing these services through various means. We provide you with a number of resources and information that you can refer to following this session. Functional aspect, or I'll say operational aspects of the waiver and the process for that also allowed the provision of audio and video equipment permitting two-way real-time interaction. Contract with entity for telemedicine, there's about 80 additional services that can be provided and a lot of clinic services at that point. You know, again, there was reimbursements under the waiver because of those emergency response needs. In recent activity, again, by the use of the expansion of the services, as we've said, hospitals have been able to increase their revenue. So the standards and guidelines are pretty clear, and they are continuing to be addressed. So some of the practice guidelines that are out there now, I'll say easy to read and useful, is the Rural Telehealth Toolkit. And then another change to allow VA as well to have the same opportunity and utilize that. Then there's the American Medical Association Telemedicine Resources, extended amount of references here for so 2014 approved guidelines to help address that. Back then, adhere to well-established principles and guidelines, inform consent processes, the security of records and information. And then continuing from that repository of information, credentials, again, state directed, but also CMS directed. There is a telemedicine by state guide that helps you know what the requirements are within your state, and two resources on state law. Then you get to some specific standards. So if you, certainly all organizations that provide care can be under the conditions of participation, but if you are also duly acknowledged, so in this case accredited by the Joint Commission or other like entities, they will have regulations around telemedicine and services as well. So 0309 EP23, again, talks about that originating site. And again, it's through that agreement. So they'll quite often pull those contracts. How that relationship is continued. Do you continue the contract? And then ultimately, we mentioned the board and senior leadership. So again, whether you're that originating site or distant site. CMS also gives reference to telemedicine standards. Again, just saying this in a different way, the credentialing and privileging process used to be quite burdensome, especially with teleradiology in the beginning. And then the Federal Register, again, that goes back to your conditions of participation. So we've listed the tag numbers here, and any of those deficiencies would also show you what types of citations they may have. With any type of care, you want to also read those EMTALA regulations for, again, how it applies to you. EMTALA regulation requires a practitioner to be available in the EDs. With any type of service, we don't want that delay in care. We want it to be in with all the reasonable amount of time. Understanding what proxy means, two ways a hospital can use for credentialing. So there's telemedicine and telehealth, how we look at that and the clarity of that word usage. And again, we can't emphasize enough understanding entity, meaning who is what party, what are the roles and responsibilities. And then more importantly, as we said, that we would work within the confines of state laws and regulations, a list of physician's privilege to do it, under what circumstances and by whom, other types of regulatory processes, so documentation, record keeping, retrieval, care delivery, different types of things like that. Was it just related to COVID? Does it have other implications now? Integrate back here just as you would evaluate not just the contract. It's got a place at your performance improvement or safety committee table. The ease of use, if you just know a list of contracts. And again, for that contract management, knowing what to pull and how it applies. And again, the setting in which we provide it, that your patient is protected as much as possible. If they have to be, making sure that the bylaws, rules, and regs and those other service line documents, language barriers, how are you dealing with that? So thank you again so much. Thank you.
Thank you, darling. Thank you, darling. That
pleasure.
was a wonderful webinar, and that does conclude the session for today. You may all disconnect now. You all have a great day ahead. Bye-bye.
Thank you all. Bye-bye. Take care.